Approximately 41 million people don't have health insurance, and it can be very scary to go to the doctor when you don't know how you're going to afford it.
And nearly 1/2 of Hispanic adults and 1/3 of African American adults lacked health insurance for all or at least part of last year.
And when it comes to health, early detection is key. So if you can't afford preventative care, CVS pharmacist Yushima Thomas is here to tell us where we can go to get it for free.
CVS Pharmacy Project Health Campaign offers free screenings through select markets throughout the entire year. But in the month of April, we're actually going to be screening for body mass index, which helps gauge your risk of disease if you're obese or overweight. We're also going to be screening for high cholesterol, high blood pressure, and high glucose levels.
And April is Minority Health Awareness Month, and certain ethnic groups experience disproportionately higher rates of disease. For instance, high glucose levels could be a sign of diabetes, and the burden of diabetes is much greater for African Americans and Hispanics. African Americans also have the highest rate of high blood pressure of all groups and tend to develop it a lot younger than any others.
So when it comes to elevated numbers for things like body mass index, glucose, blood pressure, or high cholesterol, those all can increase your risk for heart disease as well as stroke. Problem is, a lot of times there are no warning signs. Cornelius went to a screening and it saved his life. Here's his story.
Imagine waking up incoherent. I got in my car and seen a sign that said free health fairs. I took a blood pressure test. She said, you are in stroke mode. You need to report to the hospital immediately. I got to the hospital. While I was in there, my left side of my body started to tighten up and I started twitching. I was actually having a mild stroke. I could have been dead. And it was because CVS Health Fair that I'm sitting here today.
And actually, I'm happy to report that we talked to Cornelius earlier this week, and since that video last year when he had his stroke, he's lost 40 pounds.
That's great.
Yes, he's lost 40 pounds. He's actually eating healthier. He's eating healthier. He even has his wife on board. She's lost 30 pounds as well.
Oh.
Yeah, so they're eating healthier. They're having better lifestyle choices. He's up to running 2 miles a day now continuously. And what's most impressive is that before this actual screening, he was up to taking 8 medications a day. He's now down to only taking 3.
Oh,
That's absolutely
awesome.
such a great
Yeah,
story.
it is.
And that's why knowing things such as your blood pressure is elevated, it can inspire you to make very important lifestyle changes. And as always, remember to talk to your doctor if you're having any concerns about your health, and to make sure you're up to date on all of your recommended health screenings.
Correct. We are committed to helping you on a path to better health. And to help with that today, to help alleviate some of your healthcare costs, everyone in the audience will be going home today with a CVS Pharmacy gift card.
Thanks for joining us today, Yushima. We appreciate it. And for more information on preventative health screenings in your area, log on to thedoctorstv.com.